Here at GIKK Orthopedic Surgery, first and foremost, we are all orthopedic surgeons. And our practice philosophy is such that we have developed areas of expertise. And I am in the hip and knee section, which is adult reconstructive surgery, which is basically hip and knee replacement. There's very little else in terms of interventions that we can provide for patients in all of medicine that have the impact on their lives that a hip or knee replacement does for a patient who has end-stage arthritis. And we're excited about that because we can have such a positive impact on our patients' lives. For the patient who comes to our office with hip arthritis looking for hip replacement, due to the breadth of expertise in our section, we can offer that patient the standard hip replacement, which should serve that patient very well. In addition, we can provide hip resurfacing, we can provide minimally invasive approaches, and we can provide alternative bearings, which is the newer plastic, the metal on metals, and the ceramics. But the bottom line is the standard hip replacement usually serves the majority of patients extremely well. The four of us in the hip and knee section do the standard knee replacement, which is an outstanding operation for the majority of people. But we also offer alternatives such as arthroscopy to remove cartilage tears, up to partial knee replacements, all the way up to total knee replacements for the most complex deformities. The philosophy of GIKK is subspecialty care. What that means is we have all fostered each other, growing in our different areas of expertise, such that we can provide the best possible care to our patients. It's based on a simple principle that the more you do at one thing, the better you become.
So I'm Dr. Kelly. I work with GIKK Ortho Specialists. This is a knee model here. This is the quadriceps tendon, the patella, and the patellar tendon. Now when you're doing a whole knee replacement, you generally will do a long incision down the front of the knee. And then you'll turn the kneecap over and do the surgery, but you're going to be cutting up into the tendon. Once you get in there, you'll do the surgery. And this would be where you would cut off the top of the tibia bone and the bottom of the femur bone, and then replace it with the metal and plastic. Would leave the ligaments except one of them comes out, the anterior cruciate. Now let's say when you open the knee up, it's only worn out on the medial compartment, which is the inside part of your knee. Let's say it's only worn out there and the rest of it's normal. You wouldn't necessarily have to replace the whole knee. You could just go in and through a small incision usually. Now this will occur in the front of the knee. It's about a 4-inch skin incision. It'll kind of go like right here on your knee, and then you go in through the capsule. You don't get up into the tendon, and you make a little soft tissue window and get in and do the surgery and replace the inside part of the knee by making a little trough, leaving a rim of bone that you can lay the plastic inside, and on the other side you'll make a little slot and a hole for the peg of the prosthesis. And it's a resurfacing where it's very little bone is taken away, yet you still accomplish the same goal of getting rid of the pain on the inside part of the knee